Right, I'm now going to introduce the speakers. I'll introduce them both at once and then we will hear from them, obviously, in turn. Our first speaker today is Dr. Arif Husain, who is currently Chief Economist and Director of Research, Assessment and Monitoring at the World Food Programme in Rome. That's the United Nations World Food Programme. His work focuses on analysing food security and welfare in developing countries to inform humanitarian responses. Whilst his research interests include the application of information technologies to improve humanitarian responses and understanding the linkages between poverty, hunger, conflict and migration. Dr. Husain joined the World Food Programme in 2003 and has since served in many senior positions both in the field and at the HQ in Rome. And prior to joining WFP, he has worked for the World Bank and taught at the Hubert H. Humphrey Institute of Public Affairs. Following Arif, we have Dr. Lena Kearney-Hoffman, who's responding to the comments. She is an Associate Fellow of the Africa Programme at Chatham House and the Nigeria Country Lead for the Africa's Programme Social Norms and Accountable Governance, the SNAG project. She is also technical advisor to the Permanent Interstate Committee for Drought Control in the Sahel and consultant for the OECD's Sahel and West Africa Club Secretariat on cross-border cooperation, gender and women's trade networks. Previously, Lena has consulted for the World Food Programme on their work in Nigeria and Niger on gender and agricultural markets. So I'm going to hand over now to Arif to give us a presentation lasting about 15 minutes. Arif, over to you. Thank you very much.
Thank you, Tim. Good afternoon, everybody, and thanks for coming to listening to us. I was wondering that if I could start by telling you the food security situation before COVID, and then we get into what COVID is doing in different countries in Africa and elsewhere, and then talk a little bit about who are the people who are getting affected and which are the types of countries which are getting affected, and then say something about what we are doing as World Food Programme out there. And then end with like 4 or 5 recommendations which we think would be useful in these times of uncertainty, at the max, basically. So keeping that in mind, what I would do is I would just like to tell you that we, before COVID, the food security situation was not so great. For the last 4 years, there are more and more hungry people in this world. Now, we look at hunger in 2 ways. One is what we call the chronic hunger, meaning people who go to bed hungry every night, regardless of any shock or not. And that number in 2016 was 796. Today it is 821. And then the other number we look at is what we call acute hunger. Reasons like war, climate shocks, economic instability, which put ordinary people in hunger situations. And 4 years ago, that number was 80 million. Today, that number is 135 million. That's a 70% increase. So before COVID, this was the situation. And here comes COVID. And what we have done on that side, we've done some projections for this year. And what we see is that we are going to have about 130 million more people in acute hunger in this year because of COVID. And if you combine this 130 million to the already 135 million people, that is 265 million people in acute hunger in 2020. That's a very big number to deal with. Now, one other thing I wanted to say was that if we weren't talking about COVID today, we would be talking about locust, desert locust. And that is a very big emergency on its own, which is affecting parts of Africa and parts of Middle East and parts of Asia. And we need to address that as well. In terms of specifically to COVID, what we are seeing is the income effect side of that. People are getting affected because of job losses, but also losses of remittances. And together, these two, what we call the income effect, are in low and low income countries are resulting in about 130 million more people in hunger. Who is affected right now? Before COVID, we had, like I was saying, 135 million people. And about a third of these people, about 30 million people out of this, in fact, are in extreme trouble. Why? Because they live in places like war zones from where they cannot move. So think about Northeast Nigeria, think about Burkina Faso, South Sudan, Yemen, Syria, places like that. And and for their survival, they're almost reliant on humanitarian agencies. So if we don't get to them for any reason, whether it is because of money or the supply chains are not working, they will pay the ultimate price. And those people are the ones which we are extremely, extremely worried about to make sure that we can continue to get to them. The second group, if you will, is what we call the new vulnerables. These are the people who are in informal sector, in service sector, reliant on tourism, many reliant on remittances. In all people are hand to mouth. So it's almost like if you don't work, you don't eat, and your families don't eat. So we are extremely concerned about this group of individuals. In terms of Africa, also we are worried about where winter is going to come now. So the southern hemisphere, the southern African countries, where winter or the flu season is coming, and we know that they have gone through, there's a lot of poverty over there to begin with. There's a lot of food insecurity there to begin with. The health systems are quite weak. We know of countries which the whole country may have less than 10 ventilators or less than 50 ICU beds. And we have to be prepared to deal with this disease, but also the economic consequences of this disease in those places as we go forward. In terms of the World Food Program itself, we, in a given year, like last year, we assisted about 100 million people. I think we need to do probably a little bit more of that this year because of COVID. And that will require, we are voluntarily funded, and we would need about $10 to $12 billion to do that. What we are pushing right now is to make sure that we pre-position assistance like cash, like food, closer to the people who are completely reliant on us for at least the next 3 months. And that requires about almost $2 billion, which we need right now. And then the third thing which we are doing for agencies like World Health Organization is to make sure that we are able to take their supplies and medical people out to the countries where they are needed, because we are also the backbone, the logistics for the entire UN system. So we are working quite hard on that side. Now, going forward, people are asking, so what should we do? And there what we are saying is that affordable testing, and I underline affordable, testing and treatment for everyone in the world is an absolute must. It is a necessary condition. But till we get to that point, what we need to do is to make sure that we continue to save people's lives, but we also continue to save and protect their livelihoods. So we have been working on that. And in order to do that, we need to do that with the governments. So it is about scaling up social protection programs in many of the African countries, safety net programs in many of the African countries. And in order to do that, we need to create the fiscal space which is needed. So this is the time when there should be a lot of generosity in the world, where whether it is richer governments which are dealing with their own problems, they also take care of the developing countries, but also the international financial institutions coming forward, and agencies like ours providing both the resources and the technical assistance which is needed. In our case, we learned a lot from the Ebola crisis in West Africa in 2014, 2015, the lessons from that and what we can do from there. So that is really, really important. The next thing is we need to make sure that the trade keeps flowing. Commercial trade keeps flowing. Why? Because that is like economic bloodline, lifeline, basically. And if the trade doesn't work, if the supply chains don't work, we have a very big problem. Why? Because we cannot move things where they're produced to where they're needed. And our request is that no matter what, please make sure that the supply chains continue to work. The second thing which we are emphasizing is, and we have learned from the food and fuel crisis of 2008, financial crisis, Arab Spring in 2011, 2012 food crisis, that export policies like, or trade policies like export bans or import subsidies, they are almost always counterproductive and they backfire. It has never helped to starve your neighbor. And especially in an interconnected world where we are so much reliant on each other. So this is the time for governments to come together and build trade policies which make sure that we keep a coordinated response so the prices stay in control and there are no artificial shortages which would result in panic buying or copycat type of effects. And if we do that, I think we can keep up, there is ample supplies in the stocks in the world, so we can keep supplies okay. We can keep prices under check because, you know, people's purchasing power is already extremely down. So we cannot have a situation where we artificially raise prices of things in different parts of the world. So that is extremely important. Then we need to talk a little bit more about the agricultural sector. And there what we are seeing is that if you look at the World Bank report that came out, it's basically saying, particularly in Africa, that agricultural output is going to decline by anywhere from 3 to 7%. That's a lot. And also that food imports could fall from anywhere from 13 to 25%. That's even more. So agricultural sector must be treated as a critical, essential service. Why? Because we need to make sure that farmers are able to go to the field, seeds are coming into them for them, fertilizer is available. So this crisis does not turn into a bigger food shortage crisis come next year.
5 minutes, Arif.
Okay, so we have to be very much in sync on that side. And basically what we are trying to do is to make sure that we are helping the agricultural sector together with others, not only on the policy side, but also from the demand and supply side. One question which people ask me quite a bit is about, well, you know what, we have had global crises before, so what is so special about this one? And why do we use terms like, you know, unprecedented and uncharted territory? And I was thinking about it, and for me, the explanation is that previous global shocks, if you will, they've always been like a supply side shock, like let's say a big drought, or a demand side shock, like let's say a recession. But this one is both a demand side shock and a supply side shock at the same time and at a global scale. So that makes it really truly something which is uncharted and unprecedented. And what we then need to do is, what in terms of response, it is that one thing which we are seeing is that we have to have our response, which has to be a global response, which has to be a collective response to a common problem, to a common enemy. And in that sense, what we are going and saying outside is that, look, I mean, our Secretary General, as well as our Executive Director, David Beasley, he's been out there basically saying that this is the time to put our differences aside. And let's fight this common enemy as collectively as possible. And in practical terms, what that means is that in war zones where we have these 30 million people who are literally, whose lives are hanging by a thread, to make sure that there is ceasefire there. For the time being, people stop to fight, and they continue to give, or they start giving us better access, so we can get to these people and we can get to them regularly. I think that is something which is extremely, extremely important. And then I will stop on this last point, that we do really need to make sure that the economic consequences of this crisis do not end up hurting more people than the disease itself. Thank you.
Thank you very much, Arif. That was very, very powerful. And a whole host of questions are already starting to come in. People, if we've currently got 394 attendees. Clearly there isn't enough time for everybody to ask questions. So please use the question and answer function to vote on questions that other people are asking, so that we end up with a smaller number than 400. Lena, thank you very much to Arif. Lena, over to you. About 7 minutes of response to what Arif has been talking about. Are you there, Lena?
I am.
Good, thank you.
I can be heard, yeah. Thank you so much, Arif, for that very powerful and quite troubling overview of just what is the real picture of food security and resilience. Really, I think what is very striking about the conversation that we are having this afternoon is that this discussion, given all the galvanizing conditions before COVID-19 arrived on the continent of Africa, we would be having these conversations regardless of the presence of this pandemic. So I think that is quite an important point to underline, that in the tens of millions of people across the continent, from Southeast, West Africa, North Africa, were in quite vulnerable food security situations prior to this. And like you said in the beginning of your presentation, that this discussion would have been around the desert locust infestation, and as well concerns about that invasion going from East Africa, which is a reality, to West Africa as well. So there are wide-scale vulnerabilities and volatilities across the continent, besides the ways in which the global recession is impacting the continent at the moment. So I think what I would draw from, what I do draw from the report that the WFP have put out, and as well reports by the Food Crisis Prevention Network, the OECD, Sahel and West Africa Club, is that the pandemic itself for the continent isn't the real emergency. The food crisis on the back of the pandemic has just been made larger, and that is the real emergency to focus on. So I think I wanted to just go through and have a look at the recommendations that you presented, and really kind of underline, or at least kind of draw out. And I think maybe when you do your responses at the end, maybe we get a bit more information as to how, because you make really important points about coordination on a continental scale and regionally and etc. And I think there seems to be quite a mismatch in the pragmatism of that kind of approach to what seems to be unfolding on the continent at the moment, specifically with the approach to, at least the balance seems to be weighing more on the lockdowns and restrictions of movement. So in the context of a food crisis, which already is in full step on the continent, the real concern is the ways in which the approach to addressing the approach to responding to the pandemic, it will seemingly or seems to be inadvertently making the food crisis and food security situation worse, particularly in the most vulnerable places that you highlighted, like Northeast Nigeria, parts of Libya, highlighted in the report. So places where humanitarian assistance is needed urgently and was needed urgently even before the virus arrived Africa. So I think where I think this conversation would be very helpful in going in that direction is the ways in which these kinds of, the kind of information and assessments and analysis that the WFP provides and the WHO provides, how these assessments feed into national government responses, and if at all they're feeding into the ways in which national governments are responding to the pandemic. I think it was only just yesterday that the Nigerian government have decided to enforce a lockdown across Nigeria. It was, before it was specific to some particular states. And I think there is this growing, the measures around lockdown seem to be expanding, and there is no sense as whether those measures are being matched by the key measure of affordable testing that you mentioned earlier on. And I think as well, I think what is maybe worth discussing and discussing very seriously is the impact of the response to the pandemic on trade. And I think this was something that came through in the discussion we had on Tuesday with Dr. Gannon, the Vice President of the World Bank Africa, how the response to the pandemic is affecting the flow of food across the continent. I think the data that you have provided and data from other organizations that you work with, the WFP work with, have indicated that food supplies are quite robust, they're available, and they're present on the continent. What is the challenge that seems to be emerging, and the challenge that is very concerning, is the movement of that food. So where the nexus of the conversation needs to lock on is how those measures do not restrain the capabilities of the WFP and other humanitarian organizations, and even the private sector. Commercial trade was one of the things you mentioned for moving across, food moving across the continent, that we do not respond to a pandemic in a way that exacerbates hunger and food insecurity.
1 minute.
And a last, thank you, Tim, a last point that I wanted to draw on is maybe to hear a bit more from you, is how the WFP is using its gender assessment tools to help support governments and help support organizations design their responses. We know pandemics and outbreaks such as this impact women and men differently in terms of the health risks for healthcare workers who are at the front line, the risks with regards to the lockdown in increasing cases of domestic violence, the impact on reproductive health and access for particularly pregnant women on the continent. So we know these volatilities and these vulnerabilities exist, particularly for these at-risk groups. So it'd be interesting as well to hear a bit more in the discussion if you are deploying and how you are deploying the gender assessment tools, and whether the data that is informing surveillance and response plans is disaggregated, and how effectively that is being done, and if at all it is being done. So I think more on the trade side of things, coordination regionally and continentally, and as well the ways in which WFP is responding to the pandemic along gender lines, and how this pandemic will be exacerbating and making worse gender inequalities on the continent.
Thank you very much, Lena. A number of the questions that have come in raise similar sorts of comments to the ones that Lena has raised in her intervention. But Arif, is there anything immediate from Lena's comments that you would like to respond to before we get on to opening it out to the audience? Arif, are you still there?
Hi, can you hear me?
Yes.
Okay. Lena, I think, thank you. I mean, I think these are really, really very, very solid points which you have made. Let me start with coordination. Coordination amongst countries is important, but coordination amongst UN agencies is important. Coordination with private sector is important. Coordination all over, all around is important. Why? Because when we are coordinated in an environment like this, when things are so difficult to begin with, it helps. So even if you look at on the analysis side, one thing which is the global report on food crisis, this 135 million number, that is a number with a consensus of about 16 partners. On top of that, the 130 million, that is our projection, because that is something which is needed, but it will go through the same thing. Also, I think coordination, informed coordination in the sense of what I was mentioning. We have dealt with providing assistance, doing social safety nets, providing assistance to women, to children during the Ebola crisis in 3 countries, meaning Sierra Leone, Guinea, and Liberia. The lessons learned from that are priceless. And to make sure that those lessons get to people who are in power right now in multiple countries is extremely, extremely important. And we are trying to do that. That is the technical assistance part of the game, which we are doing. Also, you know, the other thing where it really matters is the monitoring. Monitoring of the situation. Our thing right now is, because situation is so fluid, use the mobile technologies, use that type of technology to get information, to collect information, collect less information, but collect it often. Why? Because things are changing. And you're using these systems. And I want to link this to the gender part. Right now, you know, like you rightly said, I mean, women and children are at risk. Women and children are at risk, not because of the lockdowns and stuff, but because of the job losses. Because of there are no nest eggs in many of these places. So what do? So we are identifying in our work how best we can bring the issues of women and children, not just about talking about it, but actually doing something about it. How can we assist people? Should we give cash? Should we give food? Should we give some kind of other assistance? What do we do? That type of things are important. Also, you know, lots and lots of schools are closed. We assist 18 million children, poor children, through school meals. How do we get to them? Now, we are focusing on that. We assist about 17 million nutrition women and children on the nutrition side. Now, how do we get to them? So we have designed ways, we are practicing ways, we are looking at the hygiene side of all of this and trying to do as best as we can together with our partners to get that.
Thank you very much, Arif. We're now going to open the floor, and we've still got about 400 people on the call, to questions. There are 2 ways of doing questions, as I mentioned. There is raise hand, and I've already got a couple of people queued up with raise hands, and then there is the Q&A, where you can upvote questions that are there or enter new ones. Clearly, we've only got 28 minutes left, so we're going to not manage hundreds of questions, but I'd like to start off with a couple of the raised hand questions to get some live participation from the audience. And I'll start off with the first raised hand, which is Temba Madariki. We will unmute you, and then if you could introduce yourself and then ask your question, and try and keep the question or comment relatively small so we can fit more people in. Temba, over to you.
Right, thank you very much. My question really
Can you introduce yourself first?
Oh, okay, I'm Dr. Temba Mdariki, and I am a medical scientist. And my question really is that there's an increased need for testing, and this has been something that has been encouraged with a lot of people, really encouraging most of these countries to test. But given the background of Africa, the lack of resources, and just given the sheer amount of logistics that is required to sort of combat this disease, is it really necessary for Africans to start getting into this testing drive? Or is it better that they use these resources or the money they would use to support this testing into other areas? Because clearly they won't be able to provide the necessary healthcare support that is needed, even if they know that the results turn out to be positive. It's always the same outcome where they'll have to just wait until those people get better, because they don't have the medicines and the resources to provide to those that are affected.
Thank you very much, Temba. That's a very interesting question. Arif, do you want to tackle that?
Yeah, sure. I think, no, thank you for the question. I think it's a very profound question. What my sense is that we need to have, at the end of the day, we need to have affordable, and I keep on saying that, affordable treatment. So people are in a stage where they say, okay, you know what? If I get sick, there is something I can take and I will get better. So the risk is minimized. I think that the approach has to be global because, this is a disease which does not know borders, it doesn't know religions, it doesn't know social status. I mean, we are seeing it happening all over the place, right? So the point should be that we have to find a solution to this problem, which is a global solution, meaning as long as the disease is there, we need to have a treatment and wherever it is. And it has to be affordable in that particular place. Why? Because if we don't sort this out and we say, no, but this is not a problem anymore in my country, we are too interconnected. 3 months, 4 months down the road, it's going to be the second wave or the third wave or the fourth wave. So it is in the global interest to have a solution which is available to the entire population of this globe in terms of a cure or a treatment for this disease as soon as possible. And if we do that, we will, in the long term, we will save money and we will save lives. So for me, more treatment than right away testing, particularly in the African context. Thank you.
Thank you very much, Arif. Thank you for that question, Temba. I'll take another question from live from the raise hand function. Sophie Zinsa, could you ask your question, introducing yourself first?
Hi, thank you so much. My name is Sophie Zinser. I'm a Schwarzman Scholar at Tsinghua University in Beijing, currently residing in Hong Kong. Thank you so much for these comments. I'm curious about what specific food supply chains you think will be most affected by COVID-19 with relation to Africa. And I've been reading, there was an article in CFR earlier this week that a sober reassessment of the relationship between China and Africa by African officials will be necessary for Africa to sort of come back on better footing. Chinese development agencies are already preparing sort of newly crafted CETA related aid packages to African countries. So I'm wondering if you think either foreign aid coming from China or technology produced in China could potentially help make up for some of the labor losses and maybe speed up production, as is already being done in terms of Chinese resources being redirected to mining in South Africa. Thank you so much.
Thank you, Sophie. Over to you, Arif.
Now, again, well, another very, very interesting question. I've been, this is where we have a bit of a, let me take the agriculture part first. if you look at the staple crop supplies at the global level, if you look at wheat, it's fine. You know, there's enough available. It's not an issue. The issue is the movement, and then the issue is transport, and the issue is the cost and availability of that transport, which could then raise prices, basically, right? Cash crops is a different story, right? Because cash crops, whether you're producing or whether you're using, that's also a function of your income. So if you have a recession where the demand starts to go down, whether your cash crops start to hurt because there's not enough demand, but while you're still producing it, right? So this is what I was saying, that this is a twin effect here. It's a supply side issue and it's a demand side issue. On one side, things are not moving. On the other side, there's not enough money. There's not enough purchasing power. So what I'm really worried about is, this is what I was saying, that the agricultural sector is a critical sector going forward. So it's not about just today, it is also about tomorrow. So what are we going to do about tomorrow if the seeds are not there, fertilizer is not there, or labor is not there to do the harvesting or the planting or the weeding, all of that type of stuff? And that's a very significant issue which needs to be dealt right away, because seasons are moving. Seasons don't stop because we have COVID. So that's on that. On the China side, I think that this is really truly the time to bring in assistance to the poorer countries, to the developing countries, to create the fiscal space so they can respond, because this is a current problem. We can't say, we will deal with this in 3 months. You may not have 3 months. So this is the reality of a lot of people, and it kind of links to the lockdowns also. I mean, if your family, if you cannot afford to feed your family because you are in a lockdown or you don't have a job to go to, there is trouble. And I wanted to say one more thing on that a lot of people that we deal with, middle class, ordinary people, we don't have big nest eggs. And there is this stage comes where you may be forced to sell something which you use to earn money. And if you get to that state and you actually sell those, it takes you a very long time to return back into the economic stream. And for me, this is where the urgency is. So that we could, through safety nets, through social protection, we could get to these people before they actually end up selling those productive economic assets that they use. So whether it is China, whether it's US, whether it's UK, whether it's South Africa, we all have to come together right now to make sure that we get the world out of this problem, because for the first time, at least in our lifetimes, we are in a state where this is something which is affecting all of us, regardless of where you are. And in a way, sitting in Western countries, you're starting to see sometimes how difficult it could be in other countries.
Thank you very much, Arif. I'm going to take some questions from the Q&A session, and there are 3 here on lockdown to follow your comments you made just a minute ago. The first one, and they're obviously all related. The first one is, lockdown measures are obviously very harsh, and then they affect internal supply chains. They affect agricultural activity. So what sorts of issues can be done to mitigate both make sure that the essential services like agriculture continue, but also that supply chains can continue? And then finally, in addition to access in conflict zones, there is a challenge to ensuring access to food for vulnerable communities living under lockdown in slums. Mm-hmm. How best to deal with those sorts of issues? So 3 slightly related questions.
No, so the last one is, I think this is what my executive director and we have been enforcing, that there are literally 30 million people in this world, mostly in war zones, who, if we cannot reach them, they cannot go, they cannot get out of there. They cannot go and find something else someplace else. We need to continue doing that, but we need to continue doing that in a way which is prudent, which saves, protects our staff, but also it protects the people we are trying to assist. And this is what I was saying. There are lessons we learned out of Ebola crisis in terms of how to help people in this. How to, if you're going to distribute food, how do you line up people in that kind of situation? How can you put sanitization stations in different places? So there are ways, there are experiences which we have learned, but that would only happen if we have the resources and the supply chains are working and we can get to them. So this is why it is so important to have that ability. The lockdown question, again, what are we? I'm sitting in Rome. I haven't left home in 6 weeks. Now, and we are the fortunate ones. Not many people cannot afford what we can. So keeping that in mind and trying to protect the people who may be at higher risk than you are, while letting others work, particularly in places where if you don't work, you don't eat. I mean, you have to, every person sort of has to think about this question very carefully. And that applies in Africa, and that applies in Europe, and that applies in the United States. I mean, we have to be, but we know that it's a trade-off right now in many places. Do you go out, or you don't go out, so you don't have money? So what do? You still have to pay your rent.
Yeah. Thank you, Arif. Let's go to a raise hand. We currently have 42 open questions in the question and answer, and about 15 people, I think, with raised hands. So we clearly won't get through all of these, but let's go to the top of the list. Andre Castro, would you like to introduce yourself and ask your question, either of Arif, and also Lena is available to take questions if you have questions for either.
Sure.
Andre.
Thank you. I am a PhD student at the University of Bonn. My first year, and I would like to ask you a question about smallholder farmers and contract farming. As we all know, smallholder farmers are crucial for providing food in low-income countries. The literature is a bit inconclusive about the effects, but this coronavirus crisis will probably not spare this agricultural practice. However, perhaps farmers could be cushioned somehow by formats of contract farming. Do you think that contract farming could reduce risks of lost output and reduce risks of sudden demand shocks? Or do you think that the fall in aggregate demand will be so severe that not even this contract farming could be a lifeline for smallholder farmers in the developing world? Thank you.
Thank you, Andre. Arif. And then Lena, if you have something to add, then please feel free. Arif first.
Look, I mean, so just to give you, I hope you agree with these numbers. I mean, we say that there are about 500 million smallholder farmers out there. And there are about 2 billion plus people who rely on them. And we also know that a lot of these farmers are net buyers. So you have to have two things happening here. One is that they have to produce for themselves, but also you have to make sure that there is enough available or enough is coming through supply in the markets for them. Now, contract farming, it's one of the options which works, but it works in bigger, let's say, large-scale production situations. And I think that should, at the end of the day, that has to continue. But that's where also you can manage in a way which is which allows you to be conscious of the health issues. And many places are actually doing that and can do that because it's organized labor. So I think that's one of the risks you're running right now, is that the shocks to the supply side, how are they going to impact the production for next year? I mean, I'm really worried about that. Yeah. And that is not only for staples, but also for cash crops. Because a lot of these places, they depend on the cash crops, and cash crops is where the money is. So I don't know if I'm answering your question, but I think it's a combination of both. One probably is more easier to deal with than the second, but the magnitude of the problem is on the bigger smallholder farmer communities across the world, and particularly in Africa.
Thank you, Arif. Lena, do you have anything to add to that?
Yeah, so I just wanted to draw kind of like a pattern across the questions and the responses from Arif. And I think at the heart of it, I think the concern of maybe a lot of people engaging with this conversation is the fact that the cure for the pandemic, particularly in the context of African economies, seems to be worse than the disease itself, the virus itself. So I think at the time we had the discussion on Tuesday with Dr. Gannon, I think the numbers of confirmed cases on the continent were around about 12,000. As of this morning, it was about 25,000 cases. Of course, we know testing capabilities are quite low on the continent, and that's to the point where of the first question we had on testing. And I just wanted to add my voice and as well just agreement with Arif on the need for testing, particularly the context of African economies, and just in the demographic difference of Africa to all the other continents, particularly being a younger continent. We know that the disease progresses differently across age structure. So in terms of gathering the kind of information we need as to how the symptoms manifest across different groups of groups in populations, it's critical for us to test and monitor and isolate and understand the disease in that kind of way. And perhaps when that is done to a critical mass level or threshold, at least, we would have the kind of data that would inform responses. I think the advice around lockdowns is really concerning, given the fact that it exacerbates a lot of these vulnerabilities and volatilities that we're seeing across the continent. So I think what seems to be a thread in the conversation so far that is, I think, very important, I think, for the advice that the WFP gives and the advice of lots of similar organizations to African governments and regional bodies, is being very cautious as to how to respond and not responding in a kind of way that makes the pandemic particularly worse for Africa. Because wherever the pandemic lingers, it affects the whole world. So there are lots of arguments enveloped within that. So yeah, so I just wanted to highlight the fact that it's really important and critically so that testing is randomized, is representative of different populations across the continent, so we understand how the disease is progressing, and we're able to moderate and be more confident in adopting different approaches to the pandemic on the continent, given, you know, existing underlying conditions, as it were.
Thank you very much, Lena. We're starting to run short of time, so I think we'll go to two more raised hand questions in turn, and then answers together from Arif and Lena. And then we'll try some quick fire questions from the chat to close out. So the two people I'm going to pick now are the top of the list, Claire Thomas and then Lawrence Freeman. Claire, can you introduce yourself and ask your question as succinctly as possible?
Yeah, I'm Claire Thomas. I work for Minority Rights Group. So we've been getting partner reports which are consistent and credible from people we trust that their communities who are ethnic or religious minorities are being skipped or ignored in the COVID-19 related food and cash for food distributions. I'm sure that you have strict protocols to ensure that your aid is distributed on the basis of need alone, but where local factors might skew that, what mechanisms do you have in place to audit for discrimination in reach, access and beneficiaries?
Thank you, Claire. Hold that one for a minute, Arif. Lawrence, can you introduce yourself and ask your question, please?
Can you hear me now?
Yep.
I'm a political economic analyst for Africa. I've been involved for about 30 years in African development policy. Thank you very much for the panel this morning. My question is, doesn't the COVID-19 crisis and the agricultural crisis in terms of limitations on food raise a similar question? That is the question of infrastructure. If we're going to treat and test people for COVID in Africa, we need many more, maybe millions more hospital beds, hospitals. We need potable water for the hospitals. We need electricity. And we need the same things for agriculture. We need roads, we need railroads, we need electricity. So both these issues together raise the question for Africa of massive investment in hard and soft infrastructure. And I was wondering if you could address that.
Thank you very much, Lawrence. Arif.
So Claire, on your question, we are, like you said, I mean, we provide assistance on the basis of need, and then we have systems, also now mobile-based systems, where if there is anything like this going on, people can actually, write back to us, actually call back to us. And these things are taken extremely seriously and addressed. So we don't see that as a big problem right now in our operations. But the mechanisms are there that if there was this problem, it could be addressed, and it is addressed. On the second question, I think you're absolutely right. I mean, development is development. We need the roads. We need the water. We are talking agriculture here. I think that the infrastructure for the irrigation, the road connecting markets to farmers to markets, having the warehouses, the insurance schemes, the grading system, all of these are extremely important things. And if these are working, then our thing is that, look, I mean, if we can bring food, we can bring something else as well, right? It's almost the same argument on this. If you have the development there and the supply chains are there and people can be accessed, then these things will happen. Okay, you may not have a lab, but you may have a mobile lab, but it's getting there. So I fully agree. Maybe there are certain things which will come out of this really tough experience, which will be positive, and there will be silver linings. And maybe this is one of them where we say, look, basic infrastructure matters, and it matters big time. Not only for COVID, but also for, frankly, livelihoods beyond COVID.
And presumably, just a brief follow-up, following on from a question from Godwin Isabor, presumably to get to the point of infrastructure, you need to have security.
Exactly.
And so that issue around reducing conflict, reducing insecurity, terrorism, etc., to ensure that the infrastructure is safe, that farmers' behaviour is safe, becomes a absolute bottom line of necessity.
Yeah, and to the point of the reality is that these pandemics might not be the last one.
Mm.
So the impact of climate change and environmental factors on the continent, there have been outbreaks of several other diseases before now. We've talked about Ebola. Some countries are in the grips of other outbreaks. There's a Lassa fever outbreak. Regularly there's cholera. So the infrastructure benefit, or the silver lining of infrastructure, hopefully should cut across these other diseases, but just even preparing populations for you know, a future where we will have to grapple with the fallout and shocks from climate change and just more pandemics and epidemics on the continent. Yeah.
Yes, thank you, Lena. And my area of speciality is in shocks to food systems, and certainly I must echo that I think this pandemic, or the locusts, or Ebola, or any of the other things that are going on are an increasing part of the expectation of what the future will be like. So building resilience as well as infrastructure, I think, is absolutely going to be a greater key necessity in the future. Now, we're just about out of time, so I don't think we've got a chance to ask any more questions. But in the last minute, I'd like to hand back both to Lena and to Arif to make a very short closing statement or closing remark, whatever you feel most appropriate. So start off, Lena, as you're on my screen.
Thank you very much, Tim. I think in terms of this conversation that we're having, and I think I'll just dial back to what I said in the beginning, how important this discussion would have been without, you know, just the looming shadow of COVID-19 over us. But I think what might be different and critically important for the continent is it's a measured look at the way the pandemic unfolds, and there should be the expectation that it would unfold differently. Therefore, responses should be different because of the unique conditions of and the vulnerabilities of populations on the continent. So I think if there is any takeaway for national governments, should be just understanding the evolution of the pandemic and understanding the vulnerabilities of their economies. So responses, you know, are representative of the realities and the difficulties and challenges governments are facing now and will continue to and will face in the future.
Thank you very much, Lena Hoffman. Brilliant. Arif, final words to you before I close out.
No, thank you very much, Tim. I think one of them first, we have a responsibility, we have a collective responsibility of saving people's lives and saving people's livelihoods. There's no doubt in my mind. And this is a global issue. That's one thing. And the second thing I want to say is that we live in a connected world where action and reactions are no longer in the same place. You have a war in Syria, refugees show up in Europe. You have high food insecurity, poverty in Central America, people show up in the US. You have Sahel issues, people come through Libya. So a lot and that makes it that it is no longer, we can say that it is somebody else's problem. And I think that is something which we need to understand, that in a global world, in an interconnected world, it is no longer somebody else's problem. Whatever is happening, it is also your problem. And if we go about this, solving this out right now, we will save resources going forward. And it would be much, much better for the political economy of the world than if we don't tackle the problem at the global scale.
Thank you very much, Arif. Very powerful comments to end with.